also check the live chat once. I'm not able to see that. Just give me a minute. Yes, a quick note, everyone, whether I'm audible and visible. So I think I am audible and visible. So yes, here we are to discuss, like not to like proper discuss all the recall questions of the INI CET, but this is just to give a quick first impression of how the INI CET May 2023 exam was. And this is to give you an overall overview, like, whether it was easy, it was difficult, and also for the students who are planning to prepare for the next INI CET, so that they would get a good idea that how actually INI CET May 2023 was, and if I compare with NEET PG, how was it different from the NEET PG exam. So if I have students here who have given the INI CET May 23 exam, even I would like to know your reaction, the first reaction basically on how did you find the exam, right? So let me just tell you, so as far as I've spoken to the students post exam, and the reaction, the response that we have got is, it's basically a mixed response that we have got regarding the exam. So some students are like happy, and some students are really like very sad post exam. And so समझ नहीं आ रहा है कि मैं रोऊं या हंसूं. So basically हंसूं because finally for the students who have given NEET PG 2023, they are done with the exam season now, I believe, and so are we as faculties also. We feel that चलो हमारा भी exam हो गया. But then at the same time, wrong, because there were definitely questions in the exam which were absolutely alien questions, right? A lot of questions which were fact based. If you know the answer, you know to it. Like there were many questions which actually did not have a lot of logical reasoning behind it. And what I feel overall, that the INI CET exam is more so, it seems like it's a PGI paper that has been put into INI CET. Majority of the questions were like multiple options correct, right? But the good thing here, if I compare to the original PGI exam, is that you don't have to choose the options like A, B, C, D, which was there the first time the pattern had changed. Now it's relatively easier in the sense, but though I feel that it's tougher than the NEET PG, and it's more time consuming than NEET PG, because in the options itself you have 1, 2 are correct, 1, 3, 4 are correct, 2, 3, 4 are correct, and you have to choose one option. But the examiners, majority of the times, they are not very kind, and the one option that we know ki chalo, out of the 4 statements, one is definitely correct, you would see that one appearing in all the 4 options, and you're like, it's gone, right? So when you have the confusion here, I don't think it helps a lot here. A lot of tricks do not help here. But yes, there were some questions where you could actually use the tricks and you could get the answers right, right? You could grab those marks. You could grab those marks like that. Yes, if I talk about the length of the paper and I compare it to NEET PG, definitely it was lengthy. Right, because as I said, majority of the questions being like multiple options correct, Vare, you have to read every option very carefully, right? So that is definitely time consuming. So one thing, INI CET, if I compare to the NEET PG, definitely it is more lengthy, especially when the amount of time that you have is also less. Right, it's 3 hours and 200 questions, unlike NEET PG where you have 3.5 hours and you have 200 questions. So yes, so now after the INI CET is done, a lot of us were not very happy after the NEET PG, thinking that the paper was difficult, it was tricky. But I think now we realize that NEET PG at least felt like to be from Earth, but INI CET definitely felt to be like from Mars. There were so many alien questions, and especially the questions, the subjects which were alien and which were from Mars. I personally feel the questions which were like that were PSM, right? Especially the statistics part of PSM, right? So it is a lot of them factual questions. Say even from start there was not a lot of logic, like the Kaplan Meer wala question tha, the survival graph mein. what technique is used for confidence bands? It is just like fact-based question. You know it, otherwise you don't know it, right? Next one, like from pharmacology, similarly, I feel a lot of questions in pharmac. There were some good questions also. Definitely the mnemonics that we keep discussing did appear, and I hope it helped you there. So what did we see in pharmacology? Some mnemonics like that I remember is the antidepressant, which has priapism as a side effect. We know that antidepressants is a favorite topic with the INI CET examiners. We know that priapism, teda wala, is trazodone. Then we had a question on clozapine as well, right? Clozapine, the count slow is the mnemonic that we have seen. It is count slow, that is agranulocytosis was the answer there. So there were some good questions also there. But when you have those difficult questions like, I don't know what, like keynote 189 clinical trial regarding the use of the monoclonal antibody in the lung cancer, right? Then a lot of new drugs were asked in the exam. Vancomycin ka dosing nomogram ka name was asked, which I'm sure that nobody has read about it. So there were definitely questions which felt like they are from mass in this exam. PSM and pharmacology, and the third subject which I felt was very alien was ophthalmology, right? But then even the examiners tend to make some silly mistakes when they set the paper. 3 to 4 questions, basically they're already given the answers in the question itself. So if you were very careful, right, in that, you could have definitely marked the right answers there. So examples of there, so then there were the questions like the question on Kawasaki. Even if nobody knows about that question, about that disease, but in the options itself, one of the option, I was told that one of the options mentioned that it is correct option, which was already mentioned. So that was a silly mistake from the examiner's end कि उन्होंने यहाँ पे करेक्ट ऑप्शन लिख के ही दिया था, राइट? इट वाज IVIG, आई बिलीव. व्हाट इज द ट्रीटमेंट? इट इज IVIG. करेक्ट ऑप्शन लिखा हुआ था. So this one question is pakka for everyone, I believe, right? So remember that it's not just us as students who make the silly mistakes in the exam. It is the examiner also. So at the end, everybody is human, and every human is allowed to make silly mistakes. So please don't feel bad, and please don't curse yourself if you've made any silly mistakes in the exam, right? So yeah, Tari, we can absolutely not do anything about it. There was this one question, then there was this other question which was like very easy, and you start thinking like INI CET में ऐसा question, so where you had match the column कि अगर mass है and it is compressing the trachea, esophagus, recurrent laryngeal nerve, what effect will it have? Okay, what effect will it have? So obviously trachea जब compress होगा तो dyspnea होगा, dysphagia तो नहीं होगा. Esophagus जब compress होगा तो dysphagia होगा. So there was some, the paper was like, I think it was a lot of a paper with a lot of outliers. The extreme values is what was there. Some questions which were very easy and some questions which were very, very difficult, right? So it had basically both the skewing is what we saw, the positive and the negative as well. So definitely it is, the paper was, I think, more time consuming, and a lot of fact-based questions also as compared to NEET PG which were there, like the effects of smoking on breast disease, all of that. The effects of BRCA1 gene, what does it do, what does it not do? So majority of the questions in INI CET had multiple options correct wale type questions, and that means that if you are planning to crack the INI CET, whatever topic you are reading, you have to read that topic in and out. They can ask anything about that topic, and then you have to choose the correct statements out of the 4 statements, right? So that is the one thing that we had seen. And yes, definitely Shubham, wohi hota hai. And the next thing that we have seen is there were match the column type of questions also, but I think the match the column is the type of questions which are actually very scoring in the INI CET exam. Because in match the column, what happens is if you see 1, 2, 3, 4 and A, B, C, D, if you are pretty sure that 1 is C and only one option is showing you that 1 is C, and that saves you that one question. Right, example of that, there was a question on the woods lamp, the fluorescence wala color. Even if you know one out of that कि इसका color ये है, erythrasma में ये आता है, tinea capitis में ये आता है, right, you are good to go with that question. So at least the good part about INI CET is what we can feel good is we don't have to choose out of the 4 options in the match the column. We have the group of the match the column which is already given in every option, and we can rule out the options and we can come to the right answer. So match the column was relatively easy, right? Woods lamp wala question, wo trachea esophagus wala question. Another very easy question was the genetics wala, right? Edwards wala, Down syndrome wala. Downs nahi, Patau's was there. Edwards and Patau's were 18, trisomy 18, trisomy 13. Then you had Huntington's, which is trinucleotide repeat. That was on the easier side, I would say. This was very easy. So there were definitely easy questions like this. Then you had the question on occupational lung disease, asbestosis, silicosis, which was another easy question, right? Which was another easy question. So I feel that overall the paper was a bit weird and eccentric, especially like I said, the subjects like PSM. I think it was not evenly distributed. The topics were not evenly distributed. And pharmacology, like we said, a lot of new drugs, random questions, and ophthalmology. Ophthalmology may again an image where the examiner tried to hide that canal of Pettit, but failed. The attempt did not go successful. So that was another question, which was a giveaway there, right? So I think the lesson that we have learned here from the INI CET exam is it is not a straightforward exam, because the type of questions that you have, the multiple options correct wale, and majority of the questions were like that, so they are time consuming. For those type of questions, we need to read the topics in and out. Overall, I would say कि yes, there were topics which were repeat also, like lithium is all time favorite. Delusional disorder, nihilistic delusion wala jo aaya tha, delusion, Cotard syndrome wala. So you get to know कि okay, these topics are important, but what we need to do is read those topics in and out. Okay, read those topics in and out. Very important. That is what we have learned from this INI CET exam. Right, and you did have questions, the other pattern of question which was there, the assertion reasoning type of questions were also there, like approximately 3 to 4 questions which were based on assertion and reasoning pattern of questions. So NEET PG I think is more straightforward, and it's just one option correct. So when you know that one option is correct, you don't have to think much about it. So I think it is much easier as compared to the INI CET exam. So I think that's the lesson that we have learned. And no matter how your exam has been, I think now it's your time basically to enjoy and party hard. You work so hard all this while. Now is the time that you party hard. And before you start your residency, which I sincerely hope that all of you would do very soon with your dream branch. So do all the parties, have good trips, go out with your friends, spend some time with your family, because again in residency you are going to be super busy. So make sure you make the best of this time as well. And thankfully INI CET does not ask us to wait for long before the results are out, right? The results would be out very soon. So if you're not planning to give any other exam, then I would say that don't even go into the recall of it कि क्या question था और क्या answer था. By the time you would be hunting for the answers, result बार आ जाएगा. So better utilize that time to basically party and enjoy. And the next one is if you are one of the students who are planning to give the exam, like next time you're planning to give the next INI CET or even NEET PG, then you should definitely see the recall sessions. Now remember, the recall sessions that we conduct is not to tell you that you mark this wrong or you mark this correct. It's basically to learn the topics that have been asked in the exam, right? So it's basically from that perspective. And we are going to conduct a mega recall session on the PrepLadder YouTube channel as well, starting 5 p.m. today. So I would be taking a dedicated radiology recall. Again, as I said, not to tell you that this is right or this is wrong, but to help us learn for the future exams. So we would be having the radiology recall session at 6 p.m. today. So multiple faculties, you would have the recall sessions one after the other. So mega recall session is what we have planned. So like I said, if you're planning to give exams, further exams, and you want to learn, then do not miss an opportunity basically to learn from these recall sessions as well. Okay, so Satya, as I said, not giving any answer key for the INI CET exam. If this was your last exam, forget about it and just move ahead is what I would say. Okay, and yes, any other queries, any other inputs regarding the INI CET exam if you have? I do think there were a lot of repeats as well, though like not significant, but same to same questions were also repeated, like the question of the ulnar nerve. In the anatomy, the image based question that we had, humerus wala, I remember discussing it in one of the recent sessions, right? So it is basically the medial epicondyle where the ulnar nerve will be injured. So head ke side mein, the head is towards the medial side, right? Head is towards the medial side, the greater tuberosity is lateral. So the one which is towards the head, that is the medial epicondyle. So basically the fracture here will injure the ulnar nerve, and that is why the patient will not be able to hold the card in between the fingers, right? So that's the same repeat question that has been asked in the previous AIMS exam with the same image also that has been asked. Okay, it's the same image that has been asked. Okay, thank you so much, Dr. Happiness, for that. Okay, so confused medico for November attempt starting, how starting from now, how should you prepare? So what I would basically suggest is, the questions which are repeated are definitely repeated, right? You cannot afford to make a mistake in those. Still, I would say the same thing. So repeat the questions, read the topics in and out. Like we said, the question on lithium, right? So lithium is asked very, very frequently. Topics like antidepressants, antipsychotics, like the ones which are asked are definitely asked again and again. The excitation, contraction, coupling, even that was asked in physiology. Again, this is a favorite with the AIMS examiners, right? So try to solve, try to read the topics in and out. And I think you should also now start including some PGIK papers, basically to get a grab of the multiple options correct type of questions. So because I think those were the ones which were the most difficult, the multiple options correct type of questions. So again, make a list of the topics right from the 2015, I would still say the same thing, that have been asked in the AIMS exam. Try to just quickly have a look at the topics that have been asked in the PGI paper as well, because the multiple options correct will have questions like that, okay, from those topics. Yeah, absolutely. Like I said, the majority of the questions were the multiple options correct type of questions. No, not really, Dr. Happiness. I don't agree to it, and honestly, did not see a lot of direct repeats in the exam, right? So I don't think that's the rule that we can say. Yeah, absolutely right. So the examiner again, I think, forgot to recheck the questions, and there were two questions on auditory pathway. So it's like if you are good with auditory pathway, it would be like a eureka moment for you, because you get two questions straight correct from that if you know the auditory pathway. Right, so two questions on auditory pathway in the exam. I hope that all of you know the mnemonic to that, which is E. colima. Right, the E basically was replaced by the spiral ganglion. Then you have the cochlear nucleus, the superior olivary, the lateral lemniscus, the inferior colliculus, the medial geniculate body, and the auditory cortex. So what we tend to do is, हमको पता है कि auditory cortex सबसे आखिरी में आएगा. So we see that in which of the options the auditory cortex is the last option, and then you realize that the examiner is smarter than we try to be smart. All the options have auditory cortex in the end, right? So this trick really did not work there, if you think like that. But in some questions, definitely, the tricks really help. Okay, so we need to learn those MCQ solving skills. So again, I would like to reiterate that it's not just reading the notes, it's not just watching the videos. Very, very important, I believe, is developing those MCQ solving skills as well, which help us, crack these MCQ, the competitive exams basically. So very, very important is please practice as many MCQs as you can while you are preparing for the exam. Okay, so cricket forever. If you're confused between two branches or anybody here who's gonna go for counseling, the best thing that you can do for deciding that which branch you need to go for is you have good enough time. Just try to spend 2 days each in the branches where you are confused. So go to a hospital, spend some time with someone, a consultant who's practicing into MD medicine or MD nuclear medicine. Because trust me that बाहर से सब कुछ बहुत अलग दिखता है. Until and unless you go on the field and experience it yourself, you will never realize what that branch actually is about. So you learn it the best way by experiencing. Just put in 2 days and see that where could you spend your time without actually looking at the watch. That means that actually you were enjoying in that department. Okay, so that's the best advice that I can give you before you actually go and choose the branch that you are planning to pursue. Yes, thank you for the input. I'll try to forward your message basically to the team and see that if we can do anything with that respect. Thank you so much, Dr. Happiness. I do believe that in the end, basically, if you have mnemonics, if you have easy tricks, that saves you a lot of time in solving the questions. The questions like on pharmacology, like we said, clozapine, trazodone, hepatitis B serology. Again, the favorite with the INI CET examiners, right? The graph which was there, jo hamesha present rahega, which is constant all the time, right? What is constantly present all the time? C for C, it is NT-HBC which is constantly present. So the plateau helped us identify that it was NT-HBC, right? So these tricks, especially for the topics which are asked frequently, we need to know that, right? The diagram of the lateral medullary syndrome, with the hypoglossal nerve was not involved. That was an easy one again, I would believe. The rest of it was shown. So that was lateral medullary syndrome. It was an easy question. It is pica. Vertebral artery was not given there. So no point in getting confused. So it was pica. The lateral medullary syndrome, that is Wallenberg syndrome. Right. So there were questions which were like straightforward, like CFTR, cystic fibrosis. Again, it's a favorite with the INI CET examiners. Every time you'll see a question on cystic fibrosis. Easy question that it's a chloride transporter which is affected. Glycine wala, collagen wala question. The most abundant amino acid is not phenylalanine. So incorrect was asked. So that was an easy one. Where you are sure that this is incorrect, you don't have to think about the other options. So all these skills, the tricks, basically you would only learn when you solve a lot of questions. Without practicing MCQs, I personally believe that it's very difficult to crack these exams. Okay. Pray, not really sure on that. But I think the interns are eligible for Elite Edge, right? It is for you guys only who are planning to appear for NEET PG or Next 24, whatever it is. So it is for the current interns only. Okay? Right. So Neetu, even I would like to go on some vacation for some time now. Thank you so much again, Game On and Dr. Happiness for that. So I hope you've got the lessons learned from the exam. And at the same time, I don't want any one of you to regret or to feel bad about your exam did not go the way that it was meant to be. Trust me, you are not there alone sailing in that ship. Everybody is in the same sailing in the same ship, right? So जैसा तुम्हारा exam हुआ है वैसा ही सबका exam हुआ है. All you need to do now is give yourself a good chill pill, enjoy, and I sincerely wish and hope and pray that you get some really good results and you get into your dream branch very, very soon. Okay, so that was a quick sneak peek here. I shall see you again today at 6 p.m. for the radiology recall session on the PrepLadder YouTube channel. And basically it's a mega recall session that we are conducting. So we'll be starting at 5 p.m. With Dr. Preeti Sharma starting the recall session at 5 p.m. So please stay tuned. You will get a notification if you are subscribed to the channel. So you would get a notification whenever the recall session starts. So we'll try to do it as soon as possible, even earlier than 5 p.m. if possible. So that's why I said if you're subscribed, you'll get a notification there. Okay. So thank you so much everyone for joining in, and I hope you've done well. And even if not, remember you are not alone. So don't be harsh on yourself. Remember, there's always going to be another chance. No chance is like the last chance, right? We tend to say that just to give ourselves those false deadlines. But in the end, be it success or be it failure, everything is temporary. So it really does not matter in the long run. What matters at the end is your mental peace, right? And your happiness. That's it. So make sure you are not letting it get disturbed no matter what happens in your life, be it on the professional front, be it on the personal front. So take care of your mental peace. That's the most important thing that I would like you to tell. Okay. So thank you so much, everyone, and goodbye. Take care and keep studying, keep revising, and keep winning. See you at 6 p.m. for the radiology recall session. Thank you.